Namaste, respected dignitaries, distinguished delegates, researchers, academicians, and dear participants. It is my privilege and honor to welcome you all to this session of 6th Viksit Bharat at 2047 conference on the theme Advancing Innovation Through Multidisciplinary Research and Transformative Education, AI, Sciences, and IKS in Multidisciplinary Synergy for a Viksit Bharat. As a session chair, I, Dr. Divya Shikhar from Amity University, Patna, look forward to insightful presentation, thoughtful discussions, and scholarly exchange from all our participants and presenters today. I encourage all the speakers to share their ideas with clarity and confidence. I invite the audience to actively engage with discussion in a spirit of academic curiosity and collaboration. At the outset, I would like to express my sincere gratitude to Vedant Education and especially Dr. Arjun Dave for his kind invitation and organizing this intellectually vibrating platform that brings together diverse disciplines, innovative ideas, and transformative academic dialogue. The theme of this conference is both timely and visionary as India moves towards dream of Viksit Bharat 2047. It becomes essential for higher education and research to embrace multidisciplinary collaboration, technological innovation, artificial intelligence, scientific advancement, and wisdom embedded in Indian knowledge systems. Conferences like these create meaningful spaces where tradition and modernity can engage in constructive dialogue. Once again, I warmly welcome you all to a highly enriching and productive session. And now we shall carry forward with our presentations.
A very good day to one and all present here. I am Dr. Swetha from MS Ramaiah College of Arts, Science and Commerce, Assistant Professor from the Department of Microbiology. So it gives me an immense pleasure to present our paper at the 5th International Virtual Multidisciplinary Conference titled Reimagining Higher Education in 21st Century, an Inclusive Way Towards Viksit Bharat via NEP 2020 and IKS. So coming to the first slide. So today we are presenting about a transformative approach to higher education titled Transformative Institutional Pedagogy, the ITIE model. This model is designed as a scalable framework that integrates academic excellence, research and student progression into a unified system. It has been implemented at MS Ramaiah College of Arts, Science and Commerce and serves as a blueprint for bridging the gap between learning and employability. So traditional lecture-centric models are no longer sufficient in today's rapidly evolving educational landscapes. As highlighted on the slide, the shift driven by industry and NEP 2020 demands more than just theoretical knowledge. So there are three major gaps in this. So lack of critical thinking due to rote learning, weak application of theoretical knowledge, limited focus on outcomes like employability. So the requirement now is to move towards a more innovative and application based and outcome based education. So coming to our framework, the ITIE framework. So this slide presents the ITIE framework as an integrated ecosystem. It consists of 4 progressive stages. The first one being inspire, second is to train the students, and third is implementing their ideas, and fourth is excelling in what they have implemented. So each stage builds upon the previous one, ensuring that continuity is present in the learning process. So unlike fragmented approaches, this model connects student motivation at the beginning to professional mastery at the end. Coming to the first phase, which is the inspire phase. The first phase is inspire, which focuses on stimulating intellectual curiosity. Before students develop skills, they must understand why learning matters. So this is achieved through 72 plus annual events, guest lectures and symposiums, and the alumni are invited for invited talks, and the industry experts are also invited for giving lectures to our students. So this phase builds intrinsic motivation, which is the foundation of competency. Coming to phase 2, which is train. So the second phase is train, which focuses on structured competency development. This phase bridges the gap between the syllabus and industry requirements through 29 value added courses, 40 industrial visits, and 36 practical sessions were conducted. So, here students gain technical, analytical, and employability skills beyond the classroom itself. Then, phase 3 is implement. In the implement phase, students transition from passive learning to active discovery. So, this includes problem based learning, research based learning, knowledge creation. For example, 45 in-house research projects involving about 64 students were conducted, and these were all DBT funded initiatives. Industry linked training with industries like Biocon were also conducted. This phase helps in transforming the learners into innovators. Coming to the next phase and the final phase, it is the Excel phase. The final phase is Excel, which validates outcomes through measurable achievements. So, the success was reflected through academic progression like cracking competitive exams like GATE, NET, IIT JAMs, global validation through paper publications and poster presentations at research, international and national conferences, and career placements in top companies. Excellence is not accidental, it is the result of previous 3 stages working together. The following slides will be explained by my colleague, Dr. Deepa VH. So, over to her.
Good day to all. I am Dr. Deepa, Assistant Professor in Department of Microbiology, MS Ramaya College of Arts, Science and Commerce. So, I am continuing with Swetha's presentation. So, research impact. This slide highlights the research impact of the model. The institution has achieved 228 total scholarly contributions, in that 139 international publications and 13 patents. Additionally, the institutional funding supports innovation. This demonstrates a strong culture of research and knowledge generation. So, when we are talking about employability outcomes, the ITIE model has significantly improved student progression outcomes. Out of 650 undergraduate students, 60 to 70% pursued higher education. 70 to 75% of postgraduate students are placed. Other key highlights: 95 to 97% progression rate, competitive median salaries. This clearly shows the model's effectiveness in enhancing employability and academic success. Holistic development. Beyond academics, the ITIE model emphasizes holistic development. Students are shaped into well-rounded individuals through physical competitiveness, social responsibility, leadership through sports achievement, outreach activities, NCC and cultural participation. The goal is not just graduates, but future leaders. Pedagogical logic. This slide explains why the ITIE model works. It is based on 3 key principles: experiential learning aligned with goal cycle, defragmentation of curriculum, scalability across institutions. This makes this model practical, integrated, and replicable. When we talk about the strategic alignments of Ramaya College, the ITIE model aligns with national and global education standards. It supports NEP 2020 goals like multidisciplinary learning, outcome-based education OBE, and NAC accreditation requirements. Thus, it is not only improve learning but also strengthens institutional compliance. The future directions: looking ahead, the model can evolve further through integration for personalized learning, global collaborations, increased research findings, interdisciplinary centers. These steps will enhance scalability and global relevance. While concluding, the ITIE model transforms higher education into an outcome-driven ecosystem. It bridges the gap between academic rigor and employability through a structured cycle: inspire, train, implement, excel. ITIE model. With a progression rate of over 95% and strong research output, it serves as a replicable blueprint for institutional excellence. We would like to thank our management, GEF Foundation, our principal, Dr. Pushpa, their constant support for all the steps what we take in the field of education, innovation and application.
So, as our PM Shri Narendra Modi has told, Viksit Bharat is a nation where no one is too small to dream and no dream is too big to achieve.
So this ITIE model of MS Ramaya College is a roadmap to achieve Viksit Bharat 2047. Once again, we thank all the organizers for giving us an opportunity to present our ITIE model in this conference.
Thank you so
Thank you so much.
I would like to congratulate Dr. Swetha, Dr. Deepa, Dr. Puspa for addressing transformative institutional pedagogy through ITIE model, that is Inspire, Train, Implement and Excel model, a scalable framework for academic excellence, research integration and student progression in higher education. A topic that is both relevant and aligned with contemporary academic and national priorities. One of the notable strengths of the paper is its effort to situate research within a broader societal and educational context. The paper raises important questions and contributes meaningfully to the ongoing discussion on transformative education and India's developmental vision. I also appreciate authors' effort in presenting a structured research design and highlighting practical implications than rather being purely theoretical. I would like to offer a few constructive suggestions that would further strengthen an already promising study. First, the paper may benefit from a clearer articulation of research gap and unique contribution at the beginning. Sometimes the readers understand the topic well, but they may find it specifically challenging that what this study can add upon so that it improves the impact of the paper also. Secondly, while findings are valuable, incorporating broader data sets, additional stakeholder perspectives, and a more rigorous statistical analysis would further improve the depth and the general understanding of the conclusion. Further, the work may also consider comparative or mixed method approach to generate richer insights. A presentation suggestion for the author would also include that a clearer conceptual model or visual framework may make this reading even more appealing for the readers or the listeners of this paper. Finally, as this conference innovation and multidisciplinary synergy, I encourage authors to further explore links with emerging technologies such as AI enabled educational practices or interdisciplinary applications. Such things may broaden the scope and relevance of this research. Overall, this is a meaningful and timely contribution. I congratulate the authors and look forward to seeing this work develop into an even stronger scholarly contribution. Thank you for being a part of this presentation.
Hello everyone, my name is Shubhangi Moghe and I'm pursuing my PhD in psychology from Karnavati University, Gandhinagar, Gujarat. My topic title is Psychological Wellbeing Among Paramedical Professions. The first author is Shubhangi Moghe and the co-author is Dr. Shaili Mishra. She is also an associate professor of psychology from Karnavati University, Gandhinagar, Gujarat. So first I would like to give the introduction about the psychological well-being. Psychological well-being referred to as mental well-being or emotional well-being, which is basically a concept that relates to an individual's overall mental and emotional state. And it also encompasses various aspects of a person's psychological health and reflects the ability to cope with life challenges, experiences positive emotions, maintaining fulfilling relationships, and function effectively in daily life. The objectives of the study is to analyze gender differences in psychological well-being among paramedical professionals. The second objective is to identify the dimensions influencing the gender differences in psychological well-being among paramedical professionals, which includes the 6 dimensions over here. The first hypothesis, there will be no significant difference in psychological well-being between male and female paramedical professionals. My second hypothesis is there will be no significant difference in the dimensions of psychological well-being between male and female paramedical professionals. So the research methodology, so the sample of 120 paramedical professionals aged between 25 to 55 years, both males and females, were selected through random sampling from Gujarat. The tool which I've used, which is a psychological well-being scale, and it is an 18-item psychological well-being scale, and it has 6 dimensions, which includes autonomy, environmental mastery, personal growth, positive relations with others, purpose in life, and self-acceptance. And the scale has 7 alternatives, and out of them, 1 alternative has to be selected. The procedure was the study employed a standardized scale to ensure participant convenience and accessibility. Data scoring was carried out using Google Docs, and the collected results were subsequently analyzed and presented. The statistical analysis which has been applied for data analysis are mean, standard deviation, and t-test. From the study showing the gender differences in psychological well-being among paramedical professionals, from the table itself, it shows that gender does not have a significant influence on psychological well-being in the present study. The second, that is the dimension-wise comparisons influencing the gender differences in psychological well-being among paramedical professions. From the above table also, it indicated that none of the dimensions, including all the 6 dimensions, they showed statistically insignificant gender differences. Then the discussion, similarly, the research conducted among Indian healthcare workers highlights that professionals often share common psychological experiences due to similar work environments, which reduces the variability and limits the emergence of statistically significant differences, which was the study was given by Rajkumar in 2022. Studies including paramedical staff have also reported relatively uniform psychological patterns across participants with limited evidence of strong group-based differences. So the conclusion of my study is that the present study concludes that psychological well-being among paramedical professionals does not significantly differ. These findings suggest that well-being in healthcare settings is shaped more by shared occupational stressors and work environments than by individual characteristics. The uniformity in well-being level highlights the influence of demanding job conditions, emotional labor, and organizational factors. Therefore, efforts to enhance psychological well-being should focus on improving workplace support, reducing stress, and promoting a positive organizational climate. Thank you.
I would like to appreciate Ms. Subhangi's and Dr. Shadi's paper entitled Psychological Well-Being Among Paramedical Professionals, as the relevance and societal importance of this study focuses on paramedical professionals, and it is highly significant because this group plays a crucial role in healthcare but often receives limited academic attention. The paper successfully highlights this research gap and contributes meaningfully to healthcare psychology. One of the strengths of the paper is its clear structure. The objectives, hypothesis, methodology, and statistical analysis are systematically presented. The use of Carol D. Rice's psychological well-being framework gives the study a strong theoretical base. The sample size is balanced in terms of gender, and use of tools such as t-test and regression analysis demonstrate methodological clarity. I would also appreciate the discussion section, which connects the findings with previous research and explains why these demographic differences may not always be significantly effective to psychological well-being among healthcare workers. Now, I would like to suggest a few points which would help in strengthening the paper. First, while the statistical findings are clearly presented, the analysis could become richer by including occupational variables such as workload, burnout, shift schedules, organizational support. These factors may provide deeper insights into psychological well-being rather than being just democratic variables alone. Secondly, the paper would benefit from adding a few practical recommendations for healthcare institutions such as resilience training, mental health counseling, or stress management programs for paramedical staff. This will increase applied value of the research. Third, further the study can include qualitative methods like interviews or case studies to capture lived experience of paramedical professionals in greater depth. In fact, your own future applications in several sections could help towards making this paper more promising. Finally, you may consider connecting the study to a broader discussion on employee well-being and sustainable healthcare system, especially in post-pandemic India. Overall, this is relevant, more organized, and methodological approach makes the paper sound with deeper analytical and variables. It has the potential to make a valuable contribution to organizational and healthcare psychological research. Thank you.
Hello everyone, I'm Dr. Namrata. I'm a PhD student in Karnavati University, Gujarat. In this 6th International Virtual Multidisciplinary Conference of Viksit Bharat, I'm going to present my paper titled Digital Tools Integrating Psychological Stress and Anxiety Management in Oral Healthcare, a Scoping Review. The theme of the conference is Advancing Innovation Through Multidisciplinary Research and Transformative Education. In this paper, my supervisor, Dr. Shelly Mishra, is a co-author. Let's begin with my conference presentation. There's a lot of literature on how stress and anxiety affect oral health, and the dental professionals are well aware about this link. But the psychological aspects are often overlooked during treatment planning and delivery in routine dental care. The reason being is that most dental professionals receive limited formal training in psychological assessment, and they rarely collaborate with mental health professionals, which is impractical in dental practice too. In current era of digitalization and technological advancement, digital tools can provide a practical solution to this problem, but their use is limited due to lack of evidence-based design, clinical validation, and a clear guidance on integrating the tools into routine oral healthcare practice. So this highlights the need to systematically examine what types of digital interventions currently exist, how they are being used in clinical settings, what outcomes they produce, and what barriers limit their implementation. This scoping review aims to fill this gap and map existing evidence on digital tools for stress and anxiety management in oral healthcare. This scoping review followed standard guidelines for scoping review. The standard databases were used for data collection like PubMed, Scopus, and Cochrane. The extracted data were narratively synthesized. Let's move on to research section. The included studies were published very recently, between 2018 to 2026. Most of the studies were randomized parallel group studies, and the research was conducted across multiple countries with a highest volume of studies from India. Most studies focused on pediatric population, and mobile health application were the most commonly used digital tools for anxiety reduction. The following types of tools were identified while searching the literature: anxiety reduction tools, stress monitoring tools, educational tools. These tools can be integrated at various stages of the dental practice for integration of digital stress assessment into routine oral health care. So this is the proposed framework. The tools can be integrated at mainly these 4 stages: pre-visit education and support, waiting room acclimatization, during treatment, and post-treatment relaxation and evaluation. The major benefits reported are reduced anxiety and improved patient cooperation. But few barriers are also identified in using these digital tools. For example, technical and software problems, difficult app navigation, communication interference caused by audio-visual devices. Although this scoping review comprehensively maps the literature, but there are few limitations too. The major concerns are heterogeneity in the included studies, designs, and small sample sizes, and lack of long-term follow-up. This systematically done scoping review conclude that digital tools such as mobile application, interactive games, AI chatbots, wearable monitoring devices, and audio-visual distraction methods show promising potential in reducing dental anxiety and improving patient comfort and cooperation during oral healthcare procedures. It highlights an important gap in the literature that most of the studies were focused on short-term anxiety reduction in pediatric patients. So further studies should be planned on the long-term stress management investigation. Key takeaway message: in alignment with the vision of Viksit Bharat 2047, this scoping review emphasizes the need for multidisciplinary collaboration among oral healthcare professionals, psychologists, AI developers, and public health researchers to develop patient-centered digital behavioral management systems for routine dental care. This review recommends advancing the innovation of culturally adaptive, AI-enabled, and clinically validated digital tools that can integrate psychological care into routine dental practice. Thank you all for your attention.
Looking at the presentation of digital tools integrating psychological stress and anxiety management in oral healthcare, a scoping review by Ms. Namrata Dagli and Dr. Shali Mishra. Commencing at the review of this paper, I would like to appreciate the relevance and innovation of this study. This paper successfully highlights how AI, mobile healthcare applications, virtual reality, wearable devices, and digital interventions can support anxiety and stress management in dental care. This is a highly contemporary and multidisciplinary topic with strong and practical significance. One major strength of the paper is its well-structured review of diverse digital tools and proposed framework integrating intervention across different stages of dental care. From pre-visiting counsel to post-treatment recovery, the paper demonstrates good academic balance by acknowledging limitations such as small sample size, methodological variability, and lack of long-term studies. I would like to suggest a few points which could help in improving this paper. You can begin with providing a deeper and conceptual understanding of difference between stress and anxiety to strengthen the theoretical clarity of the paper. And by adding a comparative table which summarizes the effectiveness, limitation, and clinical applicability of different digital tools, it would make the paper more readable and of more practical value. And the paper could include a brief discussion concerning the ethical point of view related to patient privacy, accessibility, and responsible use of AI in healthcare setting. Overall, this is a timely, well-researched, and future-oriented paper with a strong interdisciplinary relevance. With sharper conceptual framing and expanded practical implication, it has excellent scope for being published in a reputable journal. Thank you.
Hi, I am Namrata Dagli from Dr. Multidisciplinary Institute of Management and Computer Studies. I am a research scholar and as well as an assistant professor in Dr. Multidisciplinary Institute. My today's research paper title is Applying Gurukul Principles in Modern Higher Education, that is a study of awareness attitudes and adoption for Viksit Bharat 2047. This paper examines how parents and faculty view the place of Gurukul-inspired education in today's higher education landscape and how these principles can support the national aspiration of Viksit Bharat 2047. The study is based on a structured questionnaire focusing on awareness, attitudes, and perceived adoption of Gurukul values administered to a sample of 33 respondents drawn from parents and faculty residing in different parts of India. Now further, my colleague will be continuing the rest of the part.
I am Professor Seema, Premnath, Dhande. I am a research scholar and assistant professor at Dr. Multidisciplinary Institute of Management Studies, Nashik. So basically, our topic is how we should be aware about the Gurukul principles and how these principles will enhance the capabilities of our nation's next generation, our students. So for that purpose, we have prepared this paper. This will be the guideline for future scope for parents and even for the faculties, how to develop and how to impart the knowledge which is available in the world. So basically we have used different tools, survey based. 33 respondents has given the information. The tool gathered information on the basic demographics, language proficiency, familiarity with Gurukul traditions, children's preferred learning modes, satisfaction with current schooling, and opinions on incorporating elements such as holistic development, close mentoring, self-discipline, experiential learning, community orientation, and cultural continuity into education. Everyone knows, like who are studying in a different schools, different cultural schools, they know their traditions, but many of our traditions are getting missed. So for that purpose, we need to impart the Gurukul principles in schooling. So for that, a descriptive review of the responses suggests that although the current system is often rated only moderately satisfactory, there is a strong support for integrating Gurukul-based values, particularly all-round personality development, ethically grounded character formation, and practice-oriented learning. For the ethically grounded character formation, we need to know the dharma, basically what we should do and what we should not do, and we should prove those things to the children. Then and then only they can follow these principles. Otherwise, they are observing us. So for those observations, they will take what they will understand. So participants also point to shortcomings of the present model, such as excessive competition and insufficient emphasis on well-being and spirituality, alongside possibilities for introducing Indic knowledge system, value education, and integrated physical spiritual practices in institutions. The paper offered broad suggestions for higher education institutions to systematically weave Gurukul principle into curriculum design, teaching learning processes, and engagement with parents, with the aim of shaping graduates who are emotionally balanced, spiritually rooted, and socially responsible, in line with the vision of Viksit Bharat 2047. Hello, I am Divya, Assistant Professor from Dr. Multidisciplinary Institute of Management and Computer Studies, Nashik. So we have identified the gap between the modern educations and the traditional educations, which is included the Gurukul system. So here is Indian higher education is currently navigating a complex transitions. Institutions are under pressure to deliver globally competitive skills while simultaneously responding to the national calls for culturally rooted and value-based education under the vision of Viksit Bharat 2047. So several scholars argue that the prevailing models dominated by examinations, credentialism and rote learning has led to concern about student stress with ethical grounding and inadequate attention to a social emotional development. So in contrast, the traditional Gurukul system grounded in Vedic and post-Vedic thought promoted residential learning. Then
Thank you for Viksit Bharat.
Okay, done? So we can apply Gurukul principles in modern higher education, which is where is the awareness of attitude and adaptation of Viksit Bharat 2047. Thank you.
The paper, entitled Applying Gurukul Principles in Modern Higher Education, a study of awareness, attitude and adoption for Viksit Bharat 2047, by Mrs. Seema, Premnath, Dhande and co-authors. This paper addresses a highly relevant and timely issue of intersection of Indian knowledge systems, educational transformation and the vision of Viksit Bharat 2047. Within the broader conference theme of advancing innovation through multidisciplinary research and transformative education, the study offers an important perspective by exploring how traditional Gurukul principles can transform contemporary higher education practices. One of the key strengths of the paper is its focus on stakeholder perception, particularly parents and faculties, groups often overlooked while discussion usually is dominated by student-centric approaches. The author effectively connects philosophical idea of guru shishya tradition with current educational concerns such as exam pressure, loss of curiosity, and the need for holistic development. The finding highlights strong support for mentorship, experiential learning, self discipline, and value based education are especially meaningful. The paper also deserves appreciation for identifying the awareness, that is, application gap. Respondents recognize Gurukul values yet perceive limited implementation in current educational settings. The insight has a strong implication for policy and institutional reform. For constructive enhancement, I would like to add a few suggestions. That is, the author may begin by making some changes in the currently condition which relies on a smaller sample of 33 respondents. Further work with a larger and more diverse sample, including students and rural stakeholders, could further strengthen the general understanding of the paper. The methodology can also benefit by adding additional statistical rigor, perhaps through interferential analysis or correlation testing, and incorporating a deeper qualitative dimension such as interviews or focus group may reveal richer insights into how Gurukul principles can realistically be integrated in the modern higher education system. A useful presentation tip for the author would be to clearly distinguish between preserving traditional values and adapting them for contemporary context, showing how Gurukul principles can coexist with AI, technology, and multidisciplinary education. Overall, this paper makes a thoughtful contribution to the ongoing conversation on educational reforms and demonstrates how indigenous knowledge system can support a more holistic, ethically grounded, and a future ready education system. I congratulate the authors and look forward to seeing this work evolve further. Thank you.